Our health editor, Julia Seeger, is here to talk a bit more about that with us now. And Julia, good to see you. Now, this decision today is just the latest, isn't it, in the ongoing saga between Europe and AstraZeneca?
It is indeed a saga. As you said, the French Health Authority recommends that people under the age of 55 who have received the AstraZeneca shot as a first shot should get another vaccine as a second shot. And this comes after the EMA decided, recommended, or at least said that, rare blood clots should be listed as rare side effects. Now, they are rare if you take the numbers of late March, for instance, in the UK that has used AstraZeneca very much. They've vaccinated over 20 million people with that vaccine. There are about 79 blood clots. So this can seem like not very minuscule, but at the same time, what you want to know is over time whether that number will go up exponentially. Now, what's interesting is that the French Health Authority has decided to couple this, of course, with a vaccine using mRNA technology, so Pfizer or Moderna jab. And there are about 600,000 French people who are concerned today, mainly health workers, because they had a priority in this vaccination campaign. Now, you said it's a saga because I don't know if you remember this, but at the very beginning of the crisis, people were actually concerned about the use of this vaccine on elderly people because in the third clinical trial that they did, they weren't able to recruit enough elderly people to show the efficacy of their jab on that population.
Okay. Now, the French government then is saying that it wants two different vaccines to be mixed. Do they have any evidence that that is going to work?
Not so far. I mean, for now, we don't really know yet. Researchers at Oxford have started this study to determine the efficacy of this mix between the serums. We know that there are results coming in from clinical trials on animals that seem to show that it's effective and safe. Now, mixing doses is actually something that has already been used in vaccination campaigns against Ebola, against HIV/AIDS. And the idea is it's called Prime Booster, and the idea is to use two different vaccines that use two different technologies to trigger two different immune system responses, and that can actually increase the protection level of a vaccine. But in this case, they don't want to increase the protection level of the vaccine because the AstraZeneca jab has a protection rate of 75%. What they want to do is reduce the use of this vaccine.
Julia, thank you very much indeed. Julia Seeger there.